Do bony palpations, and we're going to start with the anterior side. So first we have the shaft of the clavicle coming across here, attaching at the sternoclavicular joint to the manubrium. Manubrium follows down to the sternum, and from there we're going to come across to the acromion, which comes across from the top of the spinous scapula to the front. So we have the acromion coming to the acromion process, and then coming up we have the acromioclavicular joint. Down here we have the coracoid process. All right, so now we have the humerus. As we come up, we find the greater trochanter. As we rotate the arm out, we find the bicipital groove. And we rotate even more, and we are on the lesser trochanter. And then moving out, you find the deltoid, move it down until you find the deltoid tuberosity. All right, next we have the posterior side of the shoulder, going with the scapula. First we have the superior angle of the scapula. Right below it we have the supraspinous fossa of the scapula, coming into the spine of the scapula, which goes into the acromion process. Following it down, we have the infraspinous fossa of the scapula, and we have the vertebral border of the scapula. Following it down even more, we have the inferior angle of the scapula. Coming up on the lateral side, we go into the axillary border of the scapula, and underneath is the subscapularis fossa.
Okay, now we're going to palpate the trap. So we have the upper trapezius. Its origin is the occipital protuberance, superior neutral line, and ligamentum nuchae, and it inserts at the distal one-third of the clavicle, acromion process, and scapular spine. Then we have the middle trapezius. Its origin is the ligamentum nuchae and spinous process of C7 through T1 through 5. And we have the lower trapezius. Its origin is the spinous process of T8 through T12. It inserts at the scapular spine. Okay, the actions for the traps. The upper trapezius does scapular elevation, upper rotation, and C-spine rotation. The middle trapezius does scapular retraction, and the lower trapezius does scapular retraction and depression. Okay, so now we have your rhomboids. Its origin is the spinous processes of C7 through T5, and it inserts at the vertebral border of the scapula, and it does scapular retraction, elevation, and downward rotation. Okay, so now we have levator scapulae. Its origin is transverse processes of C1 through C4, and it inserts at the superior angle of scapula, and it does scapular elevation, downward rotation, C-spine extension, and C-spine rotation. Serratus anterior, its origin is ribs 1 through 8, and its insertion is the costal surface of the superior angle and vertebral border of scapula, and the inferior angle of scapula, and it does scapular protraction, depression, elevation, upper rotation, and fixation of scapula to thorax. Okay, now we have pectoralis minor. Its origin is ribs 3 through 5, and its insertion is coracoid process, and its action is rounding of shoulders. We have the supraspinatus. Its origin is the supraspinatus fossa, and its insertion is the medial greater tuberosity of the humerus, and its action is abduction and external rotation. We have the infraspinatus. Its origin is the infraspinatus fossa, and its insertion is the lateral greater tuberosity of the humerus, and its action is external rotation and horizontal abduction. Now we have subscapularis. You can't palpate it, but its origin is the subscapular fossa. Its insertion is the lesser tuberosity of the humerus, and its action is internal rotation. I have teres minor. Its origin is the lateral upper 2/3 of the axillary border. Its insertion is the lateral greater tubercle, and its actions are external rotation and horizontal abduction. And now I have biceps brachii. Its long head origin is the supraglenoid tuberosity. Its short head origin is the coracoid process. It inserts at the radial tuberosity of the radius, and it does humeral flexion, abduction, elbow flexion, and forearm supination. Coracobrachialis, its origin is the coracoid process of the scapula. Its insertion is the medial shaft of the humerus, and it does humeral flexion and adduction. Now we have your anterior deltoid. Its origin is the lateral 1/3 of clavicle, and it inserts at the deltoid tuberosity. and its actions are humeral flexion, abduction, horizontal adduction, and internal rotation. Okay, now we have middle deltoid. Its origin is the acromion process of the scapula. Its insertion is also the deltoid tuberosity, and it does humeral abduction and flexion. Now we have posterior deltoid. Its origin is the scapular spine. It inserts at the deltoid tuberosity, and it does humeral extension, horizontal abduction, and external rotation. Okay, now we have pectoralis major. Its origin is the middle one half of the clavicle and anterolateral sternum. It inserts at the greater tuberosity of the humerus, and it does humeral adduction, horizontal adduction, flexion, and internal rotation. Now we have teres major. Its origin is the inferior angle and lower 1/3 of the axillary border. It inserts at the medial lip of the bicipital groove, and it does humeral extension, internal rotation, and adduction. Now we have your latissimus dorsi. Its origin is the spinous process of T6 through T12 and L1 through L5, and the posterior iliac crest. Its insertion is the floor of the bicipital groove, and its actions are humeral extension, internal rotation, and adduction. Now we have triceps brachii. Its long head origin is the infraglenoid tubercle. The lateral and medial head's origin is the posterior humerus. Its insertion is the olecranon process, and its actions are humeral extension, adduction, and elbow flexion.
Now we're going to do the manual muscle test for coracobrachialis. So you put them into elbow flexion, external rotation, horizontal adduction, supination, and you stabilize the back and put your hand on their bicep and push them into extension. Ready? 1, 2, 3, 4, 5, relax. We have the manual muscle test for biceps brachii. So you have a little bit of shoulder flexion and a little bit of elbow flexion, and then you're going to force them into elbow extension. So, ready? 1, 2, 3, 4, 5, relax. Now we're going to do the manual muscle test for triceps brachii. So your patient is prone and their arm is out to the side on the table, and you're going to stabilize the bicep muscle and put them into almost full extension of the elbow, and then push them into elbow flexion. Ready? 1, 2, 3, 4, 5, relax. Now we're going to do the manual muscle test for supraspinatus. So your patient's going to be standing, and you're going to put their arm in 30 degrees of abduction and hold their shoulder and push into full adduction. Ready? 1, 2, 3, 4, 5, relax. Now we're going to do the manual muscle test for anterior deltoid. So the way we remember this is by turning up the radio. So she will be here, and then I will stabilize the opposite shoulder and push the bicep into extension. So we're here, come right here. Ready? 1, 2, 3, 4, 5, relax. Now we're going to be doing the manual muscle test for the middle deltoid. So your patient's going to be sitting, arm out to the side with elbow flexed, and then I'm going to stabilize the shoulder and push the bicep muscle into adduction. Ready? 1, 2, 3, 4, 5, relax. And next we're going to be testing the lower deltoid. So this is the one where it looks like they're driving a manual car. So you're going to be here, and then you're going to be pushing them forward and into adduction. Ready? 1, 2, 3, 4, 5, relax. Now we're going to be testing the upper portion of the pectoralis major. So I'm going to be standing on the side that I'm testing and put her into 90 degrees of flexion and palm away from me, and I'm going to be pulling her arm towards me. Ready? 1, 2, 3, 4, 5. Good. Relax.
So now we're going to do the lower portion of the pectoralis major. First, we're going to have the patient lie supine. We're going to bring their shoulder into flexion with the palm facing down. They're going to be in a little bit of horizontal adduction. And now we're going to stabilize the opposite ASIS and pull them diagonally. All right, hold here. 1, 2, 3, 4, 5.
Now we're going to be doing the manual muscle test for pectoralis minor. So you're going to ask your patient to lie supine and then shrug their shoulders in the middle as much as they can, this way. And you're going to cross your arms and push their shoulders down. Ready? 1, 2, 3, 4, 5, relax. Now we're going to be manual muscle testing the infraspinatus. So your patient is going to be lying prone with their arm off the table. The GH joint is at 90, as is the elbow, with slight external rotation. And I'm going to brace at the elbow and push them into internal rotation. Ready? 1, 2, 3, 4, 5. Relax. Now we're going to be testing teres minor. So your patient is going to be lying supine, and you're going to put them into 30-degree abduction and elbow flexion, and then you're going to push them into internal rotation. Ready? 1, 2, 3, 4, 5. Relax. Now we're going to do teres major. So your patient is lying prone. You ask them to put their hand in their back pocket, like so, and you're going to force their elbow downward. Ready? 1, 2, 3, 4, 5. Relax.
Okay, now we're doing the manual muscle test for the medial rotator muscle group and subscapularis. So you're gonna put their arm on their stomach. I'm gonna brace here. Don't let me break you. 1, 2, 3, 4, 5. Relax.
Alright, so now we have the latissimus dorsi. You have your patient laying prone with shoulder flexion, horizontal adduction, and keeping their pinky to the ceiling. Alright, and when you're doing it, you're trying to pull them down to the table. Alright, don't let me break you. 1, 2, 3, 4, 5. Relax. Now we're going to do the upper trapezius manual muscle test. So you want your patient short-seated. You want them to put their ear to their shoulder, and you brace here on the shoulder, and you're trying to break them out of it. Alright, don't let me break you. 1, 2, 3, 4, 5. Relax. So now we have the middle trapezius. You want your patient lying prone. You want their arm in abduction with their thumb to the ceiling, and I'm bracing at the back and trying to push them out of it. So I'm gonna break you. 1, 2, 3, 4, 5. Relax. So now we have the lower trapezius manual muscle test. You want your patient lying prone, and you want to bring their arm into a Superman position with the thumb facing the ceiling. Brace in the center of the back. Don't let me break you. 1, 2, 3, 4, 5. Relax. Now we have the sulcus sign, and you want to place your hand above the shoulder and at the elbow, and we're pulling them apart, looking for separation in the AC joint and the humerus. So, as you can see, she has a positive sign.
Now we have the apprehension test, which tests instability of the anterior GH joint. So you have your patient lying supine, and you bring them as far back into external rotation. And a positive test is pain. Any pain?
Mm-hmm.
So he has a positive test.
Now we have the AC shear compression test, and we're looking for pain or a subluxation with this test. Place your hand behind and in front of the glenohumeral joint, interlocking your fingers, and you're just compressing in. Any pain?
When performing these manual muscle tests and special tests, you need to make sure you're checking bilaterally to see if the result is normal for the patient. When performing these manual muscle tests or special tests, you need to make sure that you perform the test bilaterally to check for something. To check for, wait, what? Hold on, what do you check for?
The acromioclavicular process, or joint. Wow.
I panicked. Trapezius, which is okay.
Yeah?
Thorax. Horizontal.
Aww.
Soup pop up. Friggity frack, it went all dark.
Torsion. Now we're going to test teres minor. So your patient's going to be lying prone, and
I'm definitely lying.
so your patient... What?
Now we have the AC shear and compression test, and we're looking for pain.
Now we have the manual muscle